management. First point is very important, and that is phenylalanine restricted diet. Right guys, restricted diet has to be given. Okay, and that has to be given for life. Right, this line is very important, right, because don't confuse if anywhere it is mentioned 3 years, 4 years, 5 years, till 4 years of age, like that. So restricted diet has to be given for life, and that is proven that high phenylalanine is always detrimental to the growth of the brain in all the babies till their life, right? And should start ASAP within 10 days of birth. You know why? To prevent the irreversible brain damage. Because after 10 days, this may already be a lot of levels of dopamine has not been produced. So already the neurotransmitter deficiency has been there, and this will prevent the growth. So restricted diet for life. Fine. Okay guys, what about breastfeeding? As per the recent articles, if and recent editions of the books, if the the phenylalanine levels are very high, right, that is beyond a particular set limit, then the breastfeeding should not be allowed for the first few weeks of life. But otherwise there is no contraindication of breastfeeding if the levels are not very high. Okay, like 1200 more than micromoles per liter. If this is the value more than that, then breastfeeding should not be allowed. So no breastfeeding allowed for 1 to 2 weeks, and guys later on it will start. So once the levels are within the range because of restricted diet, the breastfeeding should be continued, because you all know the benefits of breastfeeding, right? So that should not be removed. Okay, the benefits, we have to wait always. So guys, that is the first point. Okay guys, tyrosine now becomes essential amino acid, conditionally essential amino acid. But as per the recent editions of the book, there was no benefit of giving tyrosine to these patients was found, because already the baby was consuming some food which contains tyrosine, right? So additional supplementation of tyrosine was not found to be of any benefit. But I am just writing one line here, that tyrosine supplements can be given, right, as per the older editions of the books. Fine. Okay, so add the tyrosine supplements, as tyrosine is now a conditionally essential amino acid. So guys, this term you should know what is the meaning of conditionally essential amino acid. Clear? Okay, but currently no benefits found. Then the third is, guys, recently a drug was launched in 2020, and that is called as Palynziq, right? The actual name is pagvaliase. Okay, so Palynziq or pagvaliase is the name. What is this new drug? This is an enzyme based drug. Okay, that is, so that's a very new drug, and that will revolutionize the treatment of this disease. So it is given IV, and it is a enzyme, right? Enzyme that is called as phenylalanine ammonia lyase. Okay, phenylalanine ammonia lyase. Clear? So guys, that's the name of the drug. So this drug will simply convert phenylalanine directly to ammonia, which will be released as urea from the body. So that is like how this can be one of the best drug Okay, so guys, that is number 3, that is called as Palinsic or Pagwaliase. Fine. Okay, then few cases, guys, they will not respond to phenylalanine restricted diet, and for them there was previously a term that is called as malignant phenylketonuria. Fine. So I'm writing a point here. So this term is now dropped actually, but we should know, right? Malignant PKU. Okay. So, in spite of phenylalanine restricted diet, okay, there is neurological deficit is observed. Okay, the neurological deficits are observed. Okay, so patient is not responding, non-responders to restricted diet, we can say like that. So in spite of this restricted diet, the neurological deficit is observed. So guys, what can be the cause of that? The cause of that is called as malignant PKU. Why? So this is due to deficient BH4 synthesis, okay, or deficient dihydrobiopterin reductase deficiency. So guys, what is the job of dihydrobiopterin reductase? This is the enzyme which converts BH2 to the BH4. Okay, so this enzyme will convert BH2 to the BH4. Again, regeneration of BH4, simply speaking, right? Regeneration of the BH4. So that is the deficiency. So what is the problem here? Like if the BH4 is not regenerated, it's very simple. No BH4, less BH4. Okay, so that means less dopamine and less of serotonin, and now you can correlate why there is neurological deficits. Okay, so that's it. That's all about phenylketonuria. Okay, then previously some authors also explained that we can give L-DOPA, right? L-DOPA is something, right? You all know what is levodopa. So L-DOPA is something which can be given directly. Why? Because it can cross the blood-brain barrier and this will be a source of dopamine. So that can also be tried. But guys, main aim is not replacing dopamine. The main aim is just the decreasing the levels of phenylalanine, which is causing all the problems. So once we achieve that, this will be the great thing, right?